Hi everyone, thanks for listening to all my presentations. Today I'll be talking about gabapentin. Gabapentin could come under different brand names such as Neurontin, Gralase Triton, ACT gabapentin, AG gabapentin, Apple gabapentin, Oro gabapentin, Dom gabapentin, and so on. Gabapentin belongs to the class of medications known as anticonvulsant and is also a GABA analog, that is, gamma aminobutyric acid analog. Gabapentin could appear in various forms. For example, it could come in form of a capsule that will be taken by oral, and there we can have Neurontin at 100 milligram, 300 or 400 milligram. And also we have generic under that group as 100, 300 or 400 milligram. And could come like miscellaneous per oral like grassly starter 300 milligram or 600 milligram extended release. And could come in form of solution per oral, and then we can have Neurontin 250 milligram per 5 ml or generic 250 milligram per 5 ml or 300 milligram per 6 ml. It could also come in form of tablets per oral like Grasleys 300 milligram or 600 milligram extended release, or Neurontin 600 or 800 milligram or generic 600 or 800 milligram. And it could come in form of a cream, Neuropathic cream. Administration. Immediate release gabapentin could be given at hour of sleep to prevent somnolence and dizziness. You don't have to pay particular attention to meals. It should be given once daily or twice daily or every 8 hours. And we have to tell the patient to swallow whole if the patient is able to swallow whole. But if not, you can open the capsule and sprinkle on applesauce, orange juice, or pudding. But when it comes to the extended release form, the tablet or capsule must be swallowed whole. You don't chew, you don't crush, and you don't spit. Meals with the medication will decrease gastrointestinal tract upset, and the patient must take plenty of fluid, particularly with capsules. Uses. Gabapentin is pretty helpful in handling post-herpetic neuralgia, in seizures, alcohol withdrawal, in cough, particularly chronic cough or cough that's refractory to medications, and fibromyalgia, hiccups, or neuropathic pain. Also useful in postoperative pain, in pruritus, particularly chronic pruritus. Useful in treating restless leg syndrome. When it comes to social anxiety disorder, gabapentin could be used. Now, in women with menopause and vasomotor symptoms of menopause, gabapentin could be helpful. And as adjunct to antidepressant, you can make use of gabapentin. Adverse reactions: ataxia, dizziness, drowsiness, hypertension, weight gain, hyperglycemia, constipation. There's likelihood of increased viral infection, nausea, diarrhea. The list goes on to include myopia, conjunctivitis, diplopia, otitis media, bronchitis, fever, nasopharyngitis, anaphylaxis. Also impotency, memory impairment, asthenia, suicidal tendencies. I have to pause a bit here. This is a big issue, okay? So anyone on this medication must be closely monitored. We keep an eye, okay? Because we are not interested in seeing people dying simply because we are helping them. Urinary incontinence, thrombocytopenia, on account of which they might be bleeding, hepatotoxicity, and with that there might be jaundice, and of course respiratory depression that may lead to death. Warnings: we have to be cautious when we are on this medication, so we must watch out for anaphylaxis. Okay, then anyone on this medication must not have tasks requiring mental alertness because there will be drowsiness. So you don't operate machines, forklift, pilot flying plane, sailors, crews, sailors, drivers, and so on. No, don't drive a car when you're on this medication, particularly when you're drowsy. There's likelihood of multi-organ hypersensitivity because there will be drug reactions with eosinophilia and systemic symptoms. And of course, central nervous system could be affected, giving us increased activities, emotional lability, aggressive behaviors, and hostility. How about that? Someone who had been friendly before is now becoming very hostile simply because he or she is on gabapentin. Still on warnings, we might be faced with a life-threatening respiratory depression. So we have to be very careful when we prescribe this medication to anyone with respiratory tract problem, like chronic obstructive pulmonary disease, asthma, and particularly in the elderly. That is not it all. If we are dealing with pain and the individual is on opioids and we prescribe gabapentin at the same time the person is on opioids, there's likelihood of increased respiratory depression. We might be sending the individual to an untimely death. Increased suicidal ideation, just like I've said, under adverse reactions. I will not waste the time to repeat that again. Just keep an eye, please. Increases us if we withdraw this medication suddenly. Still on warnings, we have to be extremely cautious in certain situations. Anyone with myasthenia gravis, anyone with renal impairment, respiratory disease, seizure disorder, alcoholics, benzodiazepine, cannabis, cocaine, and opioids. If anyone is having this condition or is on this medication or has indulged in this habit, that is alcoholism and street drug ingestion, then we have to be extremely careful because we'll run into more problems. Drug-drug interaction. I will not be able to go over the entire list of all the medications that gabapentin could react with. So please contact your pharmacist or clinical pharmacologist for guidance. Note this, please. Any woman of childbearing age that is being given gabapentin should also be given folic acid, even if she's not pregnant. And if she's pregnant, must be on folic acid throughout. When it comes to pregnancy and medication, gabapentin is under category C. So we have to weigh the merit and merit before prescribing. When you give gabapentin to a breastfeeding mother, gabapentin could be present in the breast milk. And gabapentin has the potential to cross the placenta. Monitoring. Since we've gone through the warning list, we've seen that we have to be cautious in the face of renal and hepatic failure. So we have to monitor for both. Renal function test, liver function test will be required. And of course, suicide, other suicidal behavior, suicidal tendencies, suicidal attempt, or frank suicide will be a problem. So it's going to be appropriate to screen before placing that patient on that medication. And even after placing the patient on that medication, we keep an eye on that. Also, we could run into a life-threatening respiratory depression. So, having pulmonary function test done pre-medication and while the patient is on that medication for a long time will be appropriate. Mechanism of action. Gabapentin binding sites correspond to the alpha-2 theta-1 subunit of voltage-gated calcium channels, thereby inhibiting or preventing the release of excitatory neurotransmitters for epilepsy and nociception. The name GABA is coined because it is structurally related to GABA, but not binding to any of the GABA receptors, and neither affect the grading or uptake of GABA. Examples of where we can use gabapentin will include the following. But in all these examples, we have to start low and then go up slowly as per the dosage. So in alcohol use disorder, we can use immediate release at 300 mg once daily and increase by 300 mg every 2 days. But we cannot go more than 600 mg per hour 3 times daily. In alcohol withdrawal, we can use immediate release at 300 mg per hour 3 times daily on day 1 to 3, then 400 mg or 300 mg twice daily on day 4, and then discontinue. We can give 100 mg as breakthrough between day 1 and 4 if need be. In fibromyalgia, we can use immediate release at 100 mg to 300 mg once daily at hour of sleep. And in hiccups, we can use immediate release at 300 mg to 1.2 gram per day in 4 divided doses, plus or minus baclofen, proton pump inhibitor, or metoclopramide. In neuropathic pain, we can use both immediate release or extended release forms. You use the extended release at 300 mg at hour of sleep. In seizures disorders, we can use immediate release 300 mg 3 times daily up to 6 or 900 mg 3 times daily. And with that, I've come to the end of this presentation as per gabapentin. Remember to share this presentation. Remember to subscribe to my channel so that you can get all my presentations immediately they are published. I appreciate it. You are also free to leave your comment, please. Thank you.